بسم الله الرحمن الرحيم والصلاة والسلام على خير الأنام سيدنا محمد وعلى آله وصحبه وسلم. Welcome in new lecture of pharmacology of cardiovascular. Inshallah, today we'll discuss the lipid the disorder. Inshallah, we will speak about the more important key points and clinical notes about lipid disorder. Firstly, the definition of lipid disorder is abnormal level of cholesterol, triglyceride, or lipoproteins اللي هو likely it is a hyperlipidemia, increase of uh, LDL, triglyceride, and decrease of HDL, which is strongly associated with atherosclerosis, cardiovascular disease, and can be a leading cause of death due to cardiovascular disease. That is why we have to manage the hyperlipidemia. The causes could be genetics or lifestyles, or we have some disease and drugs associated with hyperlipidemia. Genetics is known as familial hyperlipidemia, and the lifestyle mainly associated with diet and inactivity and loss of exercise and alcohol consumption and smoking also, like mainly the alcohol. طيب, when we suggested the patient or accidentally we do the investigation for the patient for diagnosis, and in patient with a cardiovascular disease as a routine investigation, we do lipid profiles or lipid panel for the patient. Mainly, we focus in cholesterol, the total cholesterol, and the normal is below 200. So if it is more than 200, it is hypercholesterolemia. The LDL also, which is bad cholesterol. The LDL, the normal is below 100 if there is no cardiovascular risk. If there is a cardiovascular disease, it is recommended to be below 70. We start the treatment commonly if the patient has a severe high LDL, which is more than 190. The HDL, the normal in male, is more than, طبعا it's good cholesterol, is more than 40, and in female is more than 50. And triglyceride is below 150. Likely we start the treatment if it is very high, which is more than 500. We can start also the treatment if there is a high risk for the cardiovascular disease, a atherosclerotic cardiovascular disease, even if with just a hyperlipidemia, and it's not more than 190, for example, for LDL. How we treat the patient and when we treat the patient will be discussed later. Like in general, we treat the patient if the LDL is very high, 190 milligram per deciliter or more, and if the patient is already has a cardiovascular disease, established cardiovascular disease, or in risk for cardiovascular disease within next 10 years. Also, in patient with diabetes, we can start the statins or start the anti-hyperlipidemic drugs. So this is in general the framing of the lecture and what we speak about. Firstly, here we speak about the metabolism of lipoprotein, and it is just a revision. طبعا you discuss it in biochemistry and others. Here is the lipids, which is absorbed with bile acid as a chylomicron, which is contain a cholesterol and triglyceride. Triglyceride is hydrolyzed by the lipoprotein lipase to free fatty acids, which is used by the intestinal wall. And the remnant is known as chylomicron remnant. Mainly it is cholesterol. And then going to the liver. The liver could be stored or could be used in new formation of VLDL, or it could be used in forming of new bile acid, oxidized to new bile acids. طيب the newly forming cholesterol by hematopoietic reductase and triglyceride which is found in liver and coming from the lipolysis of adipose tissue is released as VLDL. Now the VLDL has a high triglyceride amount with cholesterol. It released in blood. In blood could be again by lipoprotein lipase transferred to free fatty acids, which is used by the body tissue. The remnant with less triglyceride, mainly the cholesterol, has three phases. One of them could be reuptake by the liver or used by tissue, or the last is precipitating in the wall of the blood vessels. And this is the problem. The cholesterol can lead to atherosclerosis, which is lead to cardiovascular events. طيب, how we can manage the patient with a hyperlipidemia? We have to interrupt this cycle. A part of the cycle we can interrupt it by one of our drugs, and then we can interrupt the formation of lipids, and we can decide which lipids we need to decrease, and then we can use the suitable drug. We have a drug which is prevent the absorption known as bile acid resin absorption by prevent absorption of bile acid. We have a drug prevent the formation of new cholesterol by hematopoietic reductase. It inhibits the hematopoietic reductase, which is the most important drug known as statin, the most commonly and primary used drug. We have a drug which is also prevent the formation of triglyceride from adipose tissue, interrupted the lipolysis, and this drug known as statins, known as niacins. And we have a drug affecting the lipoprotein lipase, increase the lipoprotein lipase synthesis and activation, which is decrease the triglyceride by increase the triglyceride used by tissue. Please note the VLDL could be expressed by triglyceride, and mainly in VLDL the triglyceride is the main lipids. And also LDL could be presented or expressed by cholesterol, because the cholesterol is mainly forming the LDL. Fine. Here, this is the classification of hyperlipidemia, and we don't need to know the details. Just we have to know that there is a primary hyperlipidemia, which is known as familiar hyperlipidemia, and it's have 5 types. And primary means genetic, yani familiar and genetic. And it could be a secondary. There is a secondary cause lead to hyperlipidemia, like hypothyroidism, nephrotic syndrome, some drugs, diabetes, alcohol, and chronic renal failure. Also, we don't need to know which type of the hyperlipidemia caused by hypothyroidism. For example, just here we need to know this is the causes of hyperlipidemia. Also, for your information, how to call the types of the hyperlipidemia, familiar hyperlipidemia. For example, type 2A, the main lipid switches increase is LDL. And زي ما قلنا نحن the LDL is expressed by cholesterol. So here in name we call them as hypercholesterolemia, because the LDL is increased. Also here in type 4, the main lipids increase is VLDL, وزي ما قلنا the VLDL is presented by triglycerides, so we can call them as a hypertriglyceridemia. طيب, how to treat the patient? Any patient with hyperlipidemia, we have to use non-pharmacological therapy and lifestyle modification with or without treatment, depend on patient. زي ما قلنا عندنا indication for use قلناها في البداية. Like not all patients should take the drug. Like all patients should going through the lifestyle modification, which is diet control, decrease the fat and calories, and use antioxidant. And the second is exercise, so weight reduction and encourage exercise. The third is the stop of alcohol and smoking or decrease them. Uh, then we have to control the risk factor like diabetes, obesity, and renal disease, and avoid the drugs that can lead to hyperlipidemia. The most common drugs that cause hyperlipidemia is the contraceptive pills, and that is why we use or we do a lipid profile before using the contraceptive pills for the female. And corticosteroids will be discussing endocrine and thiazide diuretics, which is a type of diuretics used in hypertension, and will be discussed with the hypertension, and the beta blockers, which is also used in hypertension and cardiovascular disease like heart failure and ischemic heart disease, and will be discussed later. All of them can increase the lipids, so if the patient using one of these drugs, we have to transfer to other alternative to prevent the hyperlipidemia. Like when to start the drugs, the indication, as we said before, if there is a severe LDL, which is more than 190 milligram per deciliter, if the patient is diabetic or has a cardiovascular disease or has a high risk for the cardiovascular disease with next 10 years. طبعا also, it could be used if there is a failure of non-drug therapy, like if we need, and most likely in patient with familiar hyperlipidemia, it doesn't control likely with non-pharmacological therapy, so we can use. Like we have to remind the indication which is mentioned before. طيب. The classification of hypolipidemic drugs, the drugs that decrease the lipids, we have four types. The first one inhibits the intestinal cholesterol absorption, as we said, prevent the absorption of bile acid or cholesterol selectively, and this is known as cholestyramine, cholestyramine, and ezetimibe. And the second one, we mentioned C, لأنه more important, which is known as statin. This drug is inhibits the HMG-CoA reductase, then inhibits the cholesterol and LDL. We have the primary, the HMG-CoA reductase and statin is the primary drug used for most of cases and first line for most of cases. The third is activator of plasma lipoprotein lipase, like the fibric acid derivatives known as a fibrate, and this increase and activates the lipoprotein lipase and activates the use of the tissue for the triglyceride, which is decrease the triglyceride. This drug could be a first line for patient with a hypertriglyceridemia as a dominant lipid. And the last one is inhibitors of hepatic lipid production, and this is the nicotine or vitamin B3, and we will discuss it later. Let us to start one by one. The first one is inhibitors of intestinal cholesterol absorption. And here we have two types of drugs. The first one is prevent the bile acid absorption itself. So prevent bile acid means prevent of absorption of the lipids. The lipids absorption depend on bile acid absorption. This drug known as cholestyramine and cholestyramine nowadays is less commonly used. The drug could be used for hypercholesterolemia طبعا, and could be used in a disease or diarrhea associated with bile acid malabsorption. In bile acid malabsorption, bile acid can cause irritation for the intestine, which is lead to diarrhea. This patient, when we use the drug, it will bind to the bile acid, inactivate bile acid, decrease its action on intestine, so it stop the diarrhea, so it could be used in this type of diarrhea. Also in pruritus and itching associated with obstructive jaundice. In obstructive jaundice, the bile acid increase and the bilirubin increase, which is lead to increase bilirubin in the blood itself and affecting the skin, which is cause um, irritation and itching and pruritus. When we use a drug, it will decrease the bile acid absorption, which is lead to decrease of bilirubin, وبالتالي decrease the itching and pruritus. The main adverse effect of the drug is prevent the absorption of bile acid, which is lead to prevent absorption of lipids and nutrient and drugs, which is depend on lipid on in absorption. يعني lipid soluble drug and vitamins and nutrients. So it can cause decreased absorption of fast soluble vitamin A, D, K, and E, and decreased absorption of specific drugs like digitalis and warfarin mainly. And also طبعا the lipids will be excreted and defecated with feces. So the feces will be full of fats. This is known as steatorrhea. So the patient will develop steatorrhea, could be a diarrhea associated with mucus, or even if it is mucus with feces, also called as diarrhea. طبعا it can cause nausea and vomiting for the patient. The more selective drug, the more commonly used drug nowadays is known as acetylene. And this drug is selectively for the cholesterol. It's not affecting the bile acid, وبالتالي just affecting the cholesterol, and bile acid could be absorbed with other drugs وكده وفيتامينز وكده. It's used for hypercholesterolemia, and it can cause a mild increase in hepatic enzyme, which is reversible. Within time, it returns to the normal. طيب the second drug, which is the most commonly used drug زي ما قلنا and first line of most of cases, known as statin. All of the drug end by statin. The most commonly used drug, the most high potency drug is atorvastatin and rosuvastatin, and this is the commonly used one. Lovastatin is example for low potency drugs, previously discovered, and it has many adverse effects or associated highly associated with some adverse effects, so it is not used nowadays or less used nowadays. It's just example to know is high associated with this adverse effect. طيب how this drug is working زي ما قلنا it is inhibits the HMH-CoA reductase, which is lead to decrease the cholesterol synthesis. The liver need a cholesterol, so increase the uptake of cholesterol from the blood and plasma, which is lead to decrease the cholesterol and LDL in plasma. So this drug can decrease the LDL mainly in plasma, so very effective in LDL or severe LDL. طيب. It is used طبعا for the high LDL, which is known as a hypercholesterolemia, and it could be used with combination with other if we have a combined hyperlipidemia. يعني عندنا increase in triglyceride, decrease in HDL, so we can combine the drug with other drug for treatment of these cases. The adverse effect of the drug, it can cause mainly hepatic dysfunction, increase of liver enzyme, and this is mainly by lovastatin. That's why it's not commonly used nowadays. The second is the myopathy. The drug can cause a myopathy and myositis, which is leading to a pain of the muscle. Then the patient develop a destruction of muscle cell, which is lead to release. This is with progression of myopathy. It can lead to destruction of muscle, which is lead to release of the muscle content, the potassium, the uric acid, the other content, which is could be precipitating in other organ and can lead to failure of other organ like the kidney. It can lead to kidney failure. If this occur, yani myopathy, which is lead to failure of the other organ and precipitating in other organs, so it is called as rhabdomyolysis. It's rare but a serious adverse effect. Also is associated with these drugs اللي هم statin and especially with statin. The drug is teratogenic. Drug should not be used during pregnancy. It can affecting the baby, and the benefit of the drug is outweighed the risk. The benefit is to decrease the lipids, like it can affecting the baby. So we don't use the drug during the pregnancy. Also, the drug is commonly cause nausea and vomiting and anorexia for many of patients. زي ما قلنا very important drug is statins. The third is fibric acid derivatives اللي هم بسموهم fibrates. This drug also a potent drug against triglyceride. All of the drug is end by fibrate, clofibrate, fenofibrate, bezafibrate, and gimfimprozil. The only one is gimfimprozil is not ended by the fibrate. The drug is increase the synthesis of lipoprotein lipase and its action. So it is increase the using of triglyceride by the tissue, which is lead to decrease the VLDL and triglyceride. So it is used in hypertriglyceridemia. First line for the patient with severe triglyceridemia with a triglyceride more than 500. The adverse effect of the drug, the GI upset is the main adverse effect. It can cause nausea and vomiting, and also it looks like the statin. It can cause a hepatic dysfunction and myopathy, which is lead to rhabdomyolysis. So sometimes may need to make a combination between two drugs, between the اللي هو الستاتينز with this drug اللي هو the fibrate. But the major adverse effect of this combination is the two drug can cause to myopathy, which is lead to rhabdomyolysis. So the patient will be at high risk for rhabdomyolysis and myopathy. We have to monitor the patient very well and do a creatinine kinase or creatine kinase for a patient to follow the myopathy and advise the patient about the symptoms of myopathy. المهم is not a recommended combination unless it is clearly needed. The last one is nicotinic acid, niacin, and vitamin B3. Nicotinic acid and niacin is inhibit the lipolysis of adipose tissue, which is decrease the free fatty acids and decrease the triglyceride in the liver. So decrease the hepatic release for VLDL, and the liver also need to increase the uptake. So for increase the uptake, it increase the expression of HDL. So this drug can increase the expression of HDL very well and also decrease the VLDL in blood and LDL. Commonly, we use a drug with a combination with other drugs like the fibrate أو with statins if we need it. The adverse effect of the drug. The main adverse effect is skin flushing and burning sensation, which is the most common. The drug is associated with hyperglycemia, so should not be given for a patient who are diabetic or should be avoided in diabetes unless clearly needed. And the hyperuricemia also should be avoided in patients with gout due to hyperuricemia. The patient should be avoided also in patients with severe gastric ulcer or gastritis because it can cause a gastric irritation. This is a very important slide about the effect of the anti hyperlipidemic drugs on the lipids profile. The first two drugs is bile acid resin uh, and reductase inhibitors, which is statins. The main effect of this drug on LDL. So if we have a patient with a severe LDL, high LDL, we have to use one of them. The first line and the most commonly used one with the less side effect and very effective is reductase inhibitors and in an statin. So we use this drug as the first line for all patients, and we try to control the patient with a lowest dose, then increase the dose until we reach the maximum dose. If the patient is still under the or above the target, so we can use the bile acid resins as adjuvant therapy with this drug. The effect of the drug in HDL and triglyceride is not very high, but it can decrease the triglyceride and increase the HDL as it is shown. The fibrate guna is highly effective on the triglyceride, so it is used for hypertriglyceridemia as a first line. Also, the drug has effect on HDL and LDL. And niacin mainly and highly effective in HDL, so it is used as adjuvant therapy to increase the HDL with effect in triglyceride and LDL. So, for example, if we have a patient with a high LDL, the first line will be reductase inhibitors with the lowest dose. Then we increase the dose until they maguna maximum dose, and we have to follow the patient within 6 weeks or 3 months, and then we check a lipid profile and we increase the dose till reach our target, which is mentioned in the introduction of the lecture. If not, so we have to add a new drug. The adding of the drug is depend on the lipid profile. For example, if the patient LDL is decreased, but the triglyceride is still high, so we can start another drug which is affecting the triglyceride like niacin. And then if the triglyceride is become very high, so we can do this a combination between reductase inhibitors and fibrate. Like in زي ما قلنا, it's not recommended due to rhabdomyolysis, and so we have to adjust the doses of the drug and to use a combination of the drug depend on the patient status and it is how his response. This is the last slide about the treatment with a combination or combination of the drug. We have a hypercholesterolemia, hypertriglyceridemia, and familial combined hyperlipidemia. As we said, the drugs which is effective in cholesterolemia and high LDL is statins, which is reductase inhibitors are first line, and cholestyramine as we use the maguna commonly ezetimibe instead of cholestyramine nowadays. And in triglyceridemia, we use a fibrates as a first line and niacin as additive drugs or adjuvant drug. And also here we have a drug which is not mentioned inside, which is omega-3 drug, also effective in hypertriglyceridemia. In familiar اللي هي combined hyperlipidemia, if we have a high triglyceride and a high LDL, so we have to use the two drugs, one for LDL and one for triglyceride, and this is the drugs which is used. That's all, and thank you very much, and inshallah see you in next lecture. Assalamu alaikum wa rahmatullah.